I have fatiga, you know? How you say in English, fatiga?
Okay. How long have you been fatigued?
I have fatiga very much. It happened in the morning.
Okay, so you've been tired since this morning. Do you have any other symptoms? Any fevers or chills?
Sorry?
Fevers or chills?
No.
Dizziness?
No.
Bleeding anywhere?
No, just fatiga.
Did you see your primary care doctor about this?
No.
Okay, thank you. We have a lot of very sick patients tonight, so there may be a bit of a wait, but we will take care of you as soon as we can. Robert Alvin?
Siento como si estuviera molestando a esta gente.
Rafael, por favor.
Debí haberme quedado en casa.
¿Qué te pasa?
Nada.
Mr. Hernandez, what seems to be the trouble today?
I have fatiga. Very much.
Did you just notice this, or has it been going on for a while? When did it start?
It happened in the morning. I feel very bad.
Rachel, I need a Spanish-speaking interpreter, please.
The interpreter's here?
Okay. Can you please ask this patient to describe his symptoms?
Hola, señor. ¿Puede usted, por favor, describir cuáles son sus síntomas?
Tengo mucho fatiga. Me molesta mucho.
He says that he feels very tired or very short of breath. I'm not quite sure.
Which one is it?
Cuando usted dice que tiene fatiga, ¿usted quiere decir que está cansado o que tiene dificultad para respirar?
Me falta el aire cuando respiro.
He means he's short of breath.
Well, that changes things quite a bit. I'm going to ask him some more questions, but let's get him an EKG and an O2 sat. We may need to get him over to the acute area. Mr. Hernandez, your EKG shows that you are having a heart attack. One of the arteries to your heart is blocked.
Señor Hernández, su ecocardiograma muestra que usted está sufriendo un ataque al corazón. Una de las arterias de su corazón está tapada.
You're going to need a procedure called balloon angioplasty to open the artery in your heart.
Usted va a tener que realizar un procedimiento al que llaman angioplastia de globo para abrir la arteria en su corazón.
Do you understand?
¿Entiende usted?
Sí.
Yes.
I'll go over the informed consent forms in a minute, but first I need to make sure you don't have any allergy to IV contrast dye.
Vamos a revisar los formularios de autorización en un momento, pero primero necesito saber si usted es alérgico al el tinte de contraste intravenoso.
No, no creo.
No, I don't think so.
Okay, let's go through the informed consent process and then we'll get you ready for the surgery.
My husband, okay.
Your husband had a very serious heart attack. We didn't know it at first because he didn't have any chest pain.
His heart is still good?
Well, I'm just sorry I didn't understand what he was saying sooner. We're going to do the best that we can.
Mrs. Hernandez, unfortunately, your husband had a very bad allergic reaction to the intravenous contrast that we use for the cardiac catheterization. We were not able to complete the procedure, and he had to be taken to the intensive care unit. He told us he wasn't allergic to the IV contrast, didn't he?
Please, my husband, is okay?